my highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. My name is Dr. Nat Arwa. I am a clinical pharmacist by training and by profession, and I am the founder of Progressive Pharmacotherapy Consultants, a premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management, and optimal clinical outcomes are very crucial and non-negotiable to us. Here, we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So I humbly urge you to sit back and spare me part of your very precious time to share with you some precious tips which may prove useful in your line of duty. Video is entitled Pediatric Oral Extemporaneous Preparations Made Easier. Now, I would like to start by saying that oral liquid medications are commonly extemporaneously prepared because of a relative lack of licensed formulations for groups such as the pediatrics, the very young ones, and the elderly and the frail, who are unable to swallow full tablets or capsules, or for whom the prescribed or required doses are less than single tablets or capsules. When tablets are used as a starting material or a raw material for extemporaneously preparing a suspension, care should be taken to ensure that they are ground in a mortar using a pistol to a fine uniform powder. Now, I would like to caution you that a lack of uniformity in particle size may have a detrimental effect on dose uniformity. And it is on this background that I have recorded this video to empower you and to encourage you to make a difference in the lives of those for whom whole tablets or capsules aren't the most ideal drug form. Welcome to this part of our video. Now, I would like to start with some general steps that we must take during the process of extemporaneously preparing suspensions. As a principle, we should measure out and mix together majorly Ora-Plus and Ora-Sweet, which form very popular vehicles in extemporaneous preparation of suspensions. Now, since the tablets in their solid form are unsuitable for this population, we should start by crushing the tablets thoroughly in a mortar with a pestle and triturating to obtain a fine powder. If we opt to use capsules, then the capsules should be emptied into the mortar with a pestle. Then we can also go ahead and triturate to a fine powder. Now, after the trituration process, we should then add the vehicle in small quantities to the contents of the mortar and mix well as we add the vehicle with each addition until a smooth paste is formed. After which we should then transfer the paste or the contents of the paste to the graduate, and the graduate enables us to measure our final product accurately. Next, we should use the additional vehicle that is left over to rinse the remaining drug from the mortar and add it to the graduate. After this final transfer, we should then make up the volume of the product by adding the desired quantity of the vehicle. You will find the abbreviation QS used in subsequent slides. QS means quantum satis. So after addition, we should then stir well to homogenize the product. Now, such a product should then be transferred into an amber bottle and closed properly. We should then label the finished product appropriately. In connection to PPIs, we should empty the contents of the capsule shells into a graduate, after which we should then add a buffer, sodium bicarbonate 8.4%, to the graduate and mix occasionally. We should let this mixture sit for half an hour. Now, in case you are using MAPS as your raw material, the MAPS can be dropped into an amber bottle containing the buffer, and with time such MAPS disintegrate. Now, this applies to omeprazole or esomeprazole MAPS and even pantoprazole film-coated tablets. Now, we should mix the contents of such bottles occasionally. Now, if the initial product was a capsule, then we should stir well and mix to obtain a homogeneous mixture, which can then be transferred from the graduate to an amber colored bottle. The bottle should then be corked or closed tightly. This can be followed by labeling of the product. So we'll begin with allopurinol 20 milligrams per ml. So we should count a total of 20 tablets of 100 milligram strength. Crush them thoroughly, as we explained earlier in the general part of this procedure. And of course, this quantity requires approximately 100 ml of the vehicle, which is made up of Oroplus and Orasweet. So we should follow the procedure that I outlined earlier. And once the product is ready, we can then transfer it to an amber colored bottle. Such a product is stable for 60 days, either at room temperature or under refrigeration. Our next product is Amiodarone 5 milligrams per ml. This one requires buffering for a reason I'll explain. So we should start by mixing the vehicle, which is Oroplus and Orasweet, with the buffer, which is sodium bicarbonate 8.5%, to a pH of around 7. The pH of the Oroplus plus Orasweet may vary, and for this reason the pH must be titrated to 7 and checked using a pH strip or a meter for every batch you prepare. Now, I would like to caution you not to use a predetermined amount of sodium bicarbonate. Use the pH strip to guide you. So after crushing the Amiodarone tablets, we can then wet the powder with a minimal amount of the buffered product, and of course suspend, leviate to form a viscous but smooth uniform paste. And then we can continue adding the buffered vehicle geometrically, mixing well after each addition, and then transfer it to the graduate and rinse the mortar and pestle using the buffered vehicle before topping up to the final desired volume. And I would like to remind you that we should not use all the buffered suspending mixture. We must use a volume that is required, so that at the end of the day our suspension is exactly 5 milligrams per ml. Do not exceed the desired volume. Now, I would like to caution you that such a product will clump if the buffer is not added to the vehicle. So the Aura Plus Aura Suite, which you can also call Aura Blend SF, can be substituted for Aura Blend. Aura Blend SF has sugar-free Aura Suite, just for your information. So we should transfer the ready product into an amber glass bottle and label appropriately. So for this product, we require 5 tablets of 200 milligram Amiodarone tablets, which should be crushed and ground thoroughly. And we require approximately 200 ml of the buffered vehicle, and 200 ml of the vehicle, and we need around 12 ml of sodium bicarbonate for purposes of buffering to a pH of 7. Next, I would like to talk about Amiodarone 40 milligrams per ml. Now, for this product, we require 20 tablets of 200 milligram tablets, which should be crushed and micronized. And for purposes of suspending, we require a total of 100 ml of the vehicle, which is Aura Plus and sugar-free Aura Suite. And such a product is stable, either refrigerated or at room temperature for 28 days. Our next product is amitriptyline 20 milligrams per ml. Now, because most of the time amitriptyline is film coated, I would advise you to slightly wet the tablets with a small amount of distilled water. So you require 80 tablets of the 25 milligram amitriptyline. After it has softened, go ahead and grind the tablets, or crush them into fine powder. And of course, for purposes of suspension, we require a total volume of 100 ml of the vehicle. So for the whole process, you need to ensure that the final volume does not exceed 100. That means we do not consume the whole 100 ml of the Aura Plus Aura Suite mixture. Such a final product is stable for 28 days under refrigeration or at room temperature. Our next product is Amlodipine 1 milligram per ml. For this product, we require 20 tablets of 5 milligram Amlodipine, and for purposes of suspension, we require 100 ml of the vehicle, which in this case is a mixture of Aura Plus and Aura Suite. The final product is stable for 91 days under refrigeration or for 56 days at room temperature. Our next product is aprepitant 20 milligrams per ml. For this product, we require to crush 8 tablets of the 125 milligram aprepitant, and for purposes of suspension, we require 50 ml of the vehicle, which is a mixture of Aura Plus and Aura Suite. And after homogenizing, the final product is stable for 90 days under refrigeration. Our next product is atenolol 2 milligrams per ml. So we require 5 tablets of atenolol 100 milligrams, which should be crushed and ground finely. And for purposes of suspension, we require 250 ml of sugar-free Aura Suite and an addition of 5 ml of glycerin. After homogenizing, the final product is stable for 90 days under refrigeration. Our next product is Azerthio, 50 milligrams per ml. Now for this product we require 120 tablets of the azathioprine 50 milligrams, and the total volume of the vehicle, which is Ora Plus and Ora Sweet, is 120 ml. Now after homogenizing, such a product is stable for 60 days under refrigeration. Now for the azathioprine 5 milligrams per ml, we require 10 tablets of the azathioprine 50 mg, and we require a mixture of Ora Plus and sugar-free Ora Sweet. We require a total of 100 ml, so we should ensure that the final volume does not exceed the desired value. After homogenizing, such a product is stable for 28 days at room temperature. Next we have Baclofen, 10 milligrams per ml. For this product we require 50 tablets of the Baclofen 10 mg. And for purposes of suspending, we require 50 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. Now after homogenizing, the final product is stable for 60 days, either under refrigeration or at room temperature. Next we have Boston 6.25 milligrams per ml, which slightly deviates from the rest. Now to compound it, we place the Boston tablet in a glass bottle. We add distilled water, we cap the bottle and allow the tablet to disintegrate. That takes around 5 minutes. We should then mix the solution well while stirring with a rod. Then we should then draw up the doses needed in the next 24 hours in a separate syringe, stirring between each withdrawal. We should label the syringes and the remaining solution, which can be used for a duration of 24 hours. Now, this solution must be prepared in a biological safety cabinet with proper personal protective equipment, PPEs. Now, the tablet for smaller doses may be cut into half with commercial pill cutters to obtain a dose of like 31.25 if the patient desires such a high dose. So you should. The cut tablets are stable for up to 4 weeks if stored in approved prescription containers. Now the suspensions I talked about earlier should be transferred into the amber bottle and labeled appropriately. Now I would like to emphasize that for this particular preparation we require 1 tablet of the 62.5 milligram Boston and around 10 ml of deionized water, and such a product or such a suspension is stable for only 24 hours, 1 day. Our next product is Captopril 0.75 milligrams per ml. Now for this product I would encourage you to do your med math, calculate the total number of tablets you require and the total volume of vehicle you require, and the vehicle in this case is a mixture of Ora Plus and Ora Sweet. So after suspending appropriately, the final product has a stability of 14 days under refrigeration and 1 week at room temperature. For the case of Captopril 1 milligram per ml, we can compound this by crushing properly, 2 tablets of the 50 milligram captopril, and we also require 1 tablet of 500 milligrams vitamin C and distilled water. Now that forms a buffer. Remember, vitamin C is an antioxidant, so it just stabilizes our product. After homogenizing, the final product is stable for 2 weeks, 14 days under refrigeration. We can also prepare captopril 1 milligram per ml using 2 tablets of 50 milligram captopril suspended in a mixture of Ora+ and Ora Sweet. Now the volume required is around 100 ml, but we should ensure the total volume of the suspension does not exceed 100. Now, after homogenizing, such a product is stable for a week under refrigeration. Our next product is KAVARIN 0.5 milligrams per ml. Now, to compound this, we require 4 tablets of 12.5 milligrams KAVARIN or 2 tablets of KAVARIN 25 milligrams. Now, after crushing and micronizing, we require 100 ml of a mixture of Ora+ and Ora Sweet to suspend. Ensure the volume does not exceed 100. After homogenizing, the final product is stable for 30 days under refrigeration or at room temperature. We can also prepare KAVARIN 1.67 milligrams per ml. For this product, we require 6 tablets of the KAVARIN 25 milligrams and a volume of 90 ml of the Ora+ Ora Sweet mixture. Now the final volume should not exceed 90 after homogenizing. Now the homogenized final product is stable for 2 months, 60 days under refrigeration. Next, we'll talk about ciprofloxacin, 50 milligrams per ml. So I would encourage you to do your med math and establish the total number of tablets you need to crush and grind and micronize and the total volume of the vehicle that you require. Our vehicle in this case is a mixture of Ora+ and Ora Sweet. Now, after homogenizing, the final product is stable for 91 days under refrigeration and 70 days at room temperature. Next, we'll talk about clonazepam, 0.1 milligrams or 100 micrograms per ml. Now, to compound this, we require 5 tablets of clonazepam, 2 milligrams, which should be crushed and micronized. And to suspend it, we require around 100 ml of the vehicle, which is a mixture of Ora+ and Ora Sweet. After homogenizing, such a final product is stable for 60 days under refrigeration and 28 days at room temperature. Next, we'll talk about clobazam, 1 milligram per ml. Now for this one, I'll encourage you to do your med math and establish how many of the 10 milligram tablets you require to obtain your product and calculate the corresponding volume of the vehicle, which is a mixture of Ora+ and Ora Sweet. After homogenizing, the final product is stable for 14 days under refrigeration. Our next product is clonidine, 20 micrograms per ml. So to obtain this, we should crush the clonidine tablets and triturate them to obtain fine powder in the mortar using the pestle. We should then add purified water and mix to form a paste. We should slowly add half the simple syrup to the mortar and to mix well. We should then transfer the slurry obtained to a graduated cylinder. We should then rinse whatever medication is left on the mortar with a small amount of the simple syrup and add it to the graduated cylinder, and then stir. We should then use a desired amount of the simple syrup to obtain our final volume, which we should stir thoroughly before storing in an amber-colored bottle. Now, such a product should then be labeled appropriately, and for this product we require 30 tablets of 200 micrograms or 0.2 milligram clonidine. We require 4 ml of purified water and approximately 300 ml of simple syrup. Now, after homogenizing, such a product is stable for 28 days under refrigeration. Our next product is clonidine, 100 mics per ml. For this one, we require 30 tablets of 0.2 milligrams clonidine, which should be crushed and micronized in the mortar and pestle. And we require 2 ml of purified water and a total of 60 ml of simple syrup. Now, after homogenizing, such a product is stable for 28 days under refrigeration. Now, for this case of clonidine 0.01 milligrams per ml, we require 5 tablets and approximately 100 ml of the Ora Plus Ora Sweet mixture. After homogenizing, such a product is stable for 28 days under refrigeration. Next, we'll talk about clozapine, 20 milligrams per ml. For this product, we require 20 tablets of 100 mg clozapine. After micronizing, we should suspend it in up to 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet, and ensure you do not exceed a final volume of 100. After homogenizing, such a product is stable for 28 days, either under refrigeration or at room temperature. Our next product is Depson, 2 milligrams per ml, for which we require 2 tablets of 100 milligram and approximately 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. After homogenizing, such a product is stable for 90 days at room temperature. Our next product is Dexamethasone, 1 milligram per ml. Here I would encourage you to do your med math and establish the volume of vehicle which you require and the number of tablets. Now, the vehicle used is a mixture of Ora Plus and Ora Sweet. After homogenizing, such a product is stable for 91 days at room temperature. We can also obtain dexamethasone 0.1 milligram per ml from the injection, which is a sodium phosphate injection, 4 milligrams per ml. Now, for every 2.5 ml of this injection, we require up to 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. And after homogenizing this product, it is stable at room temperature for 28 days. Our next product is Diazoxite, 10 milligrams per ml. For this product, we require 20 tablets of the 50 mg diazoxide tablets. After micronizing, this product should be suspended using up to 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. On homogenizing, such a final product is stable for 1 week, 7 days at room temperature. Our next product is diltiazem 12 milligrams per ml. For this product, we require 16 tablets of this 90 milligrams diltiazem and a total of up to 120 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. After homogenizing, the final product is stable for 2 months, 60 days under refrigeration. Next, we have Dolacetron 10 milligrams per ml. For this product, we require 12 tablets of Dolacetron 50 mg, which should be suspended in approximately 60 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. After homogenizing, such a product is stable for 90 days under refrigeration. Our next product is Enalapril 1 milligram per ml. For this product, we require 5 tablets of Enalapril 20 milligrams and approximately 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. After homogenizing, such a product is stable under refrigeration for 60 days. Our next product is ethambutol 100 milligrams per ml, for which we require 20 tablets of 400 milligram ethambutol and 20 tablets of 100 milligram ethambutol, and after micronizing all the tablets, we require approximately 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. After homogenizing, such a product is stable for 28 days at room temperature. Our next product is Vacanide Suspension 20 milligrams per ml. Now, I encourage you to do your mind math and establish the number of tablets required and the total volume of the vehicle required. Our vehicle in this case is a mixture of Ora Plus and Ora Sweet. After homogenizing, the final product is stable for 30 days at room temperature. The next product is folic acid 1 milligram per ml. For this product, we require 20 tablets of 5 milligram folic acid and approximately 100 ml of simple syrup. After homogenizing, such a product is stable for 60 days under refrigeration. Our next product is frucimide 2 milligrams per ml. Now, I'd encourage you to do your med math and establish the total volume of vehicle used in the suspending process and the total number of tablets desired. Our vehicle in this case is a mixture of Ora Plus and Ora Sweet. After homogenizing, such a product is stable for 28 days under refrigeration or at room temperature. Our next product is gabapentin 100 milligrams per ml. For this product, we require 15 capsules of gabapentin 300 milligrams. For purposes of suspending, we require a total of approximately 45 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. And after homogenizing, such a product is stable for 56 days at room temperature. The next product is Ganciclovia 100 milligrams per ml. Now, I would like to start by cautioning you that for this particular product, contact precaution is required. The product must be compounded in a biological safety cabinet, and you should don proper personal protective gear. Now, for this product, we require 80 tablets of the 250 milligram Ganciclovia. And for purposes of suspending, we use only Aura Sweet. We require up to 200 ml of Aura Sweet. We do not use Aura Plus in this case. And after homogenizing, the final product is stable for 123 days at room temperature. Our next product is Granicitron, 0.05 milligrams per ml. I would encourage you to do your math and establish the total number of tablets and the total volume of the vehicle, which is in this case is a mixture of Aura Plus and Aura Sweet. After homogenizing, our final product is stable for 91 days at room temperature. The next product is Glycopyrolate, 0.5 milligrams per ml. Here also, I would encourage you to calculate how many of the 2 milligram tablets you desire to make the preparation and the total volume of vehicle required for purposes of suspending. Our vehicle in this case is a mixture of Aura Plus and Aura Sweet. After homogenizing, the final product is stable for 60 days at room temperature. Next, we have Hydrolyzing, 4 milligrams per ml, for which we require 16 tablets of Hydrolyzing 25 milligrams and approximately 100 ml of the vehicle, which is a mixture of Aura Plus and Aura Sweet. After homogenizing, the final product is stable for 5 days under refrigeration. Next, we have Hydrochlorothiazide, 5 milligrams per ml. Now, for this product, we require 10 tablets of the 50 milligram hydrochlorothiazide and a total of around 100 ml of the vehicle, which is a mixture of Aura Plus and Aura Sweet. After homogenizing, such a final product is stable for 2 months, 60 days under refrigeration or at room temperature. Next, we have Hydroxychloroquine sulfate, 25 milligrams per ml. So I encourage you to calculate the total number of the tablets you desire to use and the volume of the vehicle required. The vehicle in this case is a mixture of Aura Plus and Aura Sweet. After homogenizing, such a final product is stable for 1 month, 38 days to be specific, under refrigeration. The next product is Hydrocortisone, 2 milligrams per ml. Now for this one, we require 20 tablets of Hydrocortisone 10 milligrams, which should be suspended in approximately 100 ml of the vehicle, which is a mixture of Aura Plus and Aura Sweet. After homogenizing, such a product is stable for 60 days under refrigeration or at room temperature. Next, we have Hydrocortisone 1 milligram per ml. For this one, we desire 10 tablets of Hydrocortisone 10 milligrams and a total of 100 ml of the vehicle, which is Aura Plus and Aura Sweet, stable for 60 days at room temperature. Next, we have Hydrea, 100 milligrams per ml. Now, I would also like to caution you that this product should be made in a biological safety cabinet. So you should start by emptying the contents of the capsules into a mortar and pestle and triturate to obtain a fine powder. You should then wet this powder with a minimum amount of the vehicle and leviate to form a viscous but smooth and uniform paste. We should then continue adding the vehicle while mixing thoroughly with each addition. We should then pour the suspension into a graduate, after which we should rinse the mortar with the vehicle, adding the rinse to the graduate until the final volume. We should then top up with the vehicle and stir thoroughly, after which we should transfer the suspension into an amber glass bottle. Such a product should then be labeled appropriately, and for this particular product we require 20 capsules of Hydrea 500 milligrams and approximately 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet, and such a product is stable for 120 days at room temperature. So next we have indomethacin 5 milligrams per ml. So you should wear your gloves and open the capsules and carefully empty their contents into the mortar. Then leviate the powder with simple syrup until a smooth paste is formed. You should then add more simple syrup to the paste until a liquid is formed. Such a liquid should then be transferred to the graduate. Then we should use additional simple syrup to rinse the mortar and pestle so that all the drug is transferred to the graduate. We should then make up to the final volume of 100 ml in the graduated measuring container using the simple syrup as our vehicle. We should then stir well. After stirring, we should then transfer the suspension into an amber glass bottle and label appropriately. For this particular product, we require 20 capsules of indomethacin 25 milligrams and a volume of around 100 ml of simple syrup. After homogenizing, such a product is stable for 60 days under refrigeration. The next product is isoniazid 10 milligrams per ml. So we should do our med math and crush the appropriate number of tablets in a mortar using a pestle to obtain a fine powder. We should then leviate the powder with distilled water until a smooth paste is formed. We should then transfer this paste to the graduated mixture. And we should use additional water to rinse the remaining drug from the mortar. We should then make up to the desired final volume in the graduated container and stir well to homogenize. Such a suspension should then be transferred to an amber glass bottle. We should then label the final product appropriately. Now in this case, our vehicle is distilled water, and after homogenizing, such a final product is stable for 21 days under refrigeration. Our next product is labetalol 40 milligrams per ml. Now for this product, we require 40 tablets of labetalol 100 mg, and we should suspend it in around 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. After homogenizing, the final product is stable for 60 days under refrigeration or at room temperature. Next, we have lamotrigine 1 milligram per ml. For this product, we require 4 tablets of 25 milligrams. After micronizing, it should be suspended in up to 100 ml of the vehicle, which is a mixture of Ora Plus and Ora Sweet. After homogenizing, such a product is stable for 91 days under refrigeration. Next, we have lansoprazole 3 milligrams per ml. Remember, this is a PPI which must be buffered in sodium bicarbonate. So we should empty the contents of the capsule into a graduate and add the desired volume of sodium bicarbonate 8.4% to the graduate with the powder. We should then allow it to mix or to sit for around 30 minutes. Occasionally we should stir the mixture. Then finally, we should stir to mix thoroughly and transfer our final product into an amber colored bottle, which should be labeled appropriately. For this product, we require 5 capsules of lansoprazole 30 milligrams and a total of around 50 ml of the sodium bicarbonate, which is our buffer in this case. And after homogenizing, such a product is stable for 30 days under refrigeration. Now, that slide shows the references that I used when compiling material for this particular video. I borrowed heavily from the handbook of extemporaneous preparation, from the Nationwide Children's Hospital formulations, and from the Sick Kids Pharmacy formulations, among others. There you have it, my esteemed fellow pharmaceutical practitioners, as we have come to the end of this presentation. I would like to encourage you to internalize its contents. I would like to motivate you to take action and motivate yourself, and to embark on the extemporaneous preparation journey for the sake of the pediatric population and the elderly or the frail patients who can't take tablets or capsules. I hope you benefited from this video. Thank you very much.